Here is a comprehensive, detailed explanation of EGFR mutation analysis based on your outline. 1. Introduction. The epidermal growth factor receptor, EGFR, is a transmembrane protein that plays a vital role in regulating cell growth, survival, proliferation, and differentiation. Mutations in the EGFR gene can lead to unregulated signaling, resulting in oncogenesis, especially in non-small cell lung cancer, NSCLC. EGFR mutation analysis has emerged as a critical molecular diagnostic tool for detecting these mutations and tailoring targeted therapies, such as tyrosine kinase inhibitors, TKIs, to individual patients. This approach is central to personalized medicine in oncology. 2. Definition. EGFR mutation analysis is a molecular genetic test that identifies specific mutations in the EGFR gene, particularly in exons 18, 21, which are known to influence cancer cell behavior. Mutations in these regions can activate the EGFR pathway abnormally, causing increased tumor cell proliferation, survival, angiogenesis, and metastasis. Detecting these mutations helps clinicians choose targeted drugs that specifically inhibit the mutated EGFR protein. 3. Indications. EGFR mutation analysis is recommended for patients with newly diagnosed advanced NSCLC, individuals with adenocarcinoma histology, or those with non-smokers. Tumor progression or relapse after initial treatment. Planning second-line therapy after resistance to first-line EGFR inhibitors. Cases with metastatic colorectal cancer, rarely as part of extended molecular profiling. Used for. The test is used in clinical settings to detect actionable EGFR mutations, determine eligibility for EGFR-targeted therapy, predict treatment response and prognosis, monitor resistance during or after treatment, support clinical trial enrollment for investigational drugs. Why do need of this test? To identify if a patient with NSCLC has an EGFR mutation, which would make them eligible for EGFR TKI therapy, e.g. gefitinib, erlotinib, osimertinib. To personalize therapy and avoid ineffective treatments. To reduce exposure to unnecessary chemotherapy and its side effects. To monitor resistance mutations like T790M, which can develop during therapy and necessitate a switch in drugs. 6. What happens during the test? Sample collection. Tissue biopsy. A small piece of tumor tissue is obtained via bronchoscopy, CT-guided needle biopsy, or surgical biopsy. Liquid biopsy, ctDNA. A blood sample is collected to detect circulating tumor DNA, less invasive. Laboratory processing. DNA extraction. DNA is extracted from tumor cells or plasma. Mutation detection techniques. PCR-based assays, e.g. real-time PCR, ARMS. Next-generation sequencing, NGS, offers high sensitivity for multiple mutations. Sanger sequencing, less commonly used now. FISH IHC, occasionally used for gene amplification or protein overexpression. Quality control. Samples undergo stringent checks to ensure reliability. 7. How long for my results? Tissue-based EGFR testing typically takes 7 to 14 days, depending on lab turnaround time. Liquid biopsy, blood test, faster, with results in 3 to 7 days. Rapid EGFR mutation tests, point of care, are being developed in some centers for quicker decisions. 8. Prepare for this test. Tissue biopsy. Inform your doctor about any bleeding disorders or medications, especially blood thinners. You may be advised to fast or avoid specific drugs before the procedure. You might need sedation or anesthesia during biopsy. Liquid biopsy, blood test. No special preparation required. Drink water and eat normally unless instructed otherwise. 9. Risks for biopsy, pain, bleeding, infection, and rare complications like pneumothorax if lung biopsy. Requires local or general anesthesia in some cases. For blood test, minimal risk, such as bruising or mild pain at the needle site. Psychological risk, emotional distress due to learning about advanced disease or treatment resistance. 10. Normal values. There are no absolute normal values in EGFR testing. Result categories. Mutation positive. Common mutations include exon 19 deletion, most common, 45%, exon 21 L858R substitution, exon 20 insertion, often resistant to TKIs, T790M mutation, resistance mutation, mutation negative, no EGFR mutations detected in the tested regions. 11. Interpretation of results. Positive result suggests likely response to EGFR TKI therapy. Exon 19 deletion and L858R respond well to first and second generation TKIs. T790M mutation indicates acquired resistance. Patient may benefit from osimertinib. Exon 20 insertions may not respond to standard TKIs, but newer drugs, imobocertinib, may be considered. Negative result, EGFR TK not indicated. Consider testing for other mutations, e.g. ALK, KRAS, ROS1, MET, RET. Factors affecting results. Low tumor content in the sample. Degraded DNA or poor sample preservation. Tumor heterogeneity. Different parts of the tumor may show different mutations. Prior therapy may change tumor DNA, resistance mutations. Time of sample collection. Fresh versus archived tissue affects accuracy. Test sensitivity. NGS is more sensitive than traditional PCR or Sanger sequencing. 13. Clinical significance. Prognostic value. EGFR mutation positive patients generally show better initial response and progression-free survival on TKIs. Predictive value strongly predicts response to EGFR TKIs. Guides drug selection. Exon 19 deletion, L858R, gefitinib, erlotinib, afatinib. T790M, osimertinib. Exon 20 insertions, poor prognosis, emerging drugs, e.g. amivantamab. Essential for precision oncology and clinical trial inclusion. #14 No more. EGFR is part of the ERB family of receptors. EGFR mutations are most common in Asian patients, non-smokers, females, adenocarcinoma subtype of NSCLC, first-generation TKIs, gefitinib, erlotinib, second-generation TKIs, afatinib, dacomitinib, third-generation TKIs, osimertinib, active against T790M and CNS metastases. Resistance is often inevitable. New mutations arise with time, e.g. C797S. Conclusion. EGFR mutation analysis is a vital diagnostic and prognostic tool in the era of precision oncology. It enables clinicians to personalize therapy based on genetic profiles, improving survival and quality of life for patients with NSCLC and other cancers. As technology evolves, non-invasive tests like liquid biopsy and NGS platforms are making the test more accessible and accurate. Understanding EGFR mutations is essential for optimal cancer care, treatment selection, and monitoring resistance. Thank you. Have a nice day.